at 1, breaking news from the White House. President Donald Trump has been diagnosed with a chronic condition. Good afternoon. This is the KTLA 5 News at 1. I'm Glenn Walker.
And I'm Lou Parker. It's called chronic venous insufficiency, and it was revealed in today's White House press briefing.
KTLA 5's Corrine Winter live now in the newsroom with what we are learning about the diagnosis. Corrine?
Lou and Glenn, we spoke with doctors, and the good news is that this is a benign and common vein condition. The president had a medical exam done when he noticed there was some swelling in his legs in recent weeks. Chronic venous insufficiency. You may not have heard of this condition. Doctors say it's common and benign and is often seen in people over the age of 70. That's what President Trump was diagnosed with. The White House press secretary making the announcement today.
Laboratory testing included a complete blood count, comprehensive metabolic panel, coagulation profile, D-dimer, B-type natriuretic peptide, and cardiac biomarkers. All results were within normal limits.
This condition occurs when veins in the legs struggle to allow blood to flow back up to the heart. Caroline Levitt also telling reporters the examination didn't show any evidence of more serious conditions like deep vein thrombosis or arterial disease. Also that the president remains in excellent overall health. The White House medical unit provided this care out of an abundance of caution. Levitt said President Trump, who is 79 years old, wanted her to share his medical diagnosis with the public.
There are a subgroup of patients that do develop symptoms from this. Again, it can be pain, swelling, cramping at night. And then in severe cases, some patients do develop ulcers from this, and that's a smaller percentage of patients.
Recent photos revealed bruising on the back of the president's hand. President Trump's doctors say that was consistent with minor soft tissue damage from frequent handshaking.
Most of the time, actually, we can treat this condition what we say conservatively. So that we say lifestyle modification. So a few things that they can probably recommend for him. I mean, I'm not speaking for his doctors, but sometimes we can simply take care of that by giving people compression stockings, for instance, and that should take care of the symptoms and a lot of the discomfort that people have. And most of the time, that can be enough.
As for treatment,
I think the swelling in the legs is what really drove the testing. The bruising on the hands, I know they did other testing for that. It's less commonly associated with this condition, although when you do have this condition, sometimes your skin can be a little bit more sensitive.
The president had his annual physical exam back in April, with doctors saying at the time he was in excellent cognitive and physical health and fit to perform the duties of the commander-in-chief and head of state. Now, as for possible risk factors tied to this condition, they include a family history of varicose veins, tobacco use, and obesity. That's the very latest in the newsroom. I'm Corrine Winter. Lou and Glenn, we'll send it to you now in the studio.
Corrine, thank you.